Hey folks, hope you're well and healthy, most importantly. During this time, are you curious what it would be like to be inside a nursing home amongst the most vulnerable population during the COVID crisis, let alone try to run one of those facilities? Well, today we have a very special guest on our show via Skype, a dear client of mine and an all-around great guy, Doug Grant. And he'll give us a little perspective. Hi, Doug. Thanks for speaking with us. So let me ask, what exactly is it like trying to run a skilled nursing home in the midst of the COVID-19 crisis?
Well, Legal Fox, picture yourself on a treadmill and it goes faster and faster. And you're really going nowhere, though. Then all of a sudden that treadmill stops and you fly backwards and you have to start over and over and over again. However, the most amazing thing about this is how my staff is reacting. We pull together. You know, we've been through hurricanes and other things. It's amazing what we're doing and how the dedication of everybody, nurses, aides, housekeepers, how amazingly they pull together.
Excellent. Okay, I'm really glad to hear that. And speaking of that, how many staff members do you have and how many residents?
I have 265 various employees from many backgrounds. And I have 180 residents. It's a subacute unit. I'm not in a grandmother's style nursing home. I know, Legal Fox, you've been here. You have clients here. I'm sure you can attest to the type of building that we have.
Yes, very well run. Of course, I haven't been able to be there recently, unfortunately, but yes, you definitely do.
We look forward to having you back.
Oh, thank you. Right, and now considering all these visitation restrictions that are in place, how have the residents been reacting to that?
Well, initially it was very interesting because when we first started with clamping down on the visitation, there was a little bit of relief from the residents, because they're so used to having family members come. This was like a welcome relief because I think a lot of residents don't want to be a burden upon their families. But then when the state came around and they clamped down activities in a group setting or group dining, that changed how this happens, how things go, because we had to then worry about their psychosocial well-being. We brought in psychologists to see them, and so that was unique. I've never experienced that.
I see. And the communal dining, if I understand correctly, that had to stop, and certain group activities, and wow, that must have been a tough part. I see.
It was tough when you can't bring in the accordion player at dinner time, or lunchtime. That's tough.
Yeah, that would be tough on me too. Now, how about the family members? How have they been reacting to this restriction?
Well, they're actually more sensitive about it. We put in place no visitors even before the state decided to do it, and we did it on a Friday afternoon around 3 o'clock. Next thing you know, visitors are on their way to come visit after work, and I had to stand outside and tell them, I'm very sorry, you can't come in. What?
Wow.
I can't come in? They were shocked. Some were so shocked, I'm calling the police, they said.
Wow.
So it was very tough. Imagine trying to tell a loved one that they can't see their loved one. So that was very unique. It's happened in hurricanes, but usually, a hurricane comes and goes. This is different because nobody knows how long this is going to last.
Yeah, there's so much uncertainty involved.
We are screening like we've never screened before. I've had my temperature taken. I've had my oxygen levels tested. Thank God it's a digital thermometer, because it was the other thermometer. It used to be done the old-fashioned way, and that would be a little difficult here.
Yes, I can certainly understand that. Okay, now let us know a little bit how people might be able to help. So Doug, tell us, how can people help?
Well, people can really help by not buying all the masks that are available online. Healthcare workers need those masks, and while we have them, we're really struggling to get more to help our staff. I mean, obviously, if you have like HIV or cancer and you're immunocompromised, yes, you should have a mask. But it's the healthcare workers that need it. Really, the best thing to do, if you're healthy, stay 6 feet away from somebody. That seems to work.
Nice.
Obviously, they're saying stay at home now. That works too.
Got it, got it. Okay. And now I saw something on your social media posts about sending greeting cards to the residents. Can you elaborate a little on that?
Well, you know, not we came to discover that not everybody has Skype. Ironically, we're using Skype today, but not everybody has that. So I came up with the idea of how could we get communications going with families or just from the outside world. And then I remembered my father. My father used to love getting a card. He, whether it was a picture of the nephews, and that's where I came up with the idea. I said, let's get everybody mailing in cards. Pretty much, it's like, hi, we're thinking about you. Everything's going to be great. You're going to be fine. And it's nice because they also, with no visitors, they can decorate the room. It's something to look
Sure.
at. And it's actually working really well.
I
We're
see.
getting lots in.
Okay, yeah, that's a great idea because I assume it keeps them engaged and they don't utilize some of the methods some people would, like social media, or maybe they don't know how to use it. So old school mail could be very helpful. Now, speaking of mail, there's some things out there that, are concerns about transmitting it, or, just from your end, being a healthcare professional, is there anything specifically to be concerned about? I
The
think,
only real concern with mail that what we were told was do not send cardboard.
hmm,
Cardboard is a COVID-19 calamity. It really is.
hmm.
Um, I guess things stay on that surface longer than, say, paper. So please do not send gifts or anything in a cardboard box.
So here at Legal Fox TV, as you probably know, we do like to try to highlight at least a little of the lighter side of things. So I know it's difficult during these times, but is there anything at all that might be even mildly amusing or fun that you've witnessed or heard?
You know, the craziest thing I heard or saw, even on Facebook, was that people actually thought you could get coronavirus from drinking a Corona beer. That is preposterous.
Wow,
If
wow,
anything, it
okay.
might kill it.
Yes, it is not professional advice, everybody, but I could see why that happens. Yes, okay, quite a timely comment because it may be happy hour somewhere where someone's watching this and they could crack open a Corona without having to worry. So, on that note, I'm going to leave it at that. And we definitely want to thank you for your time and speaking with us. We really wish you and your staff a ton of luck. You guys have a very hard job, and we respect you very much.
Well,
Thanks again.
thank you, Legal Fox. And I also want to remind everybody, please, please wash your hands.
Yes, definitely wash our hands. All right. Thanks again, Doug. Ciao.
Bye bye.